PCOD or polycystic ovarian disorder has become a widespread issue. PCOD mostly strikes at an early age and therefore a substantial number of young women go through this problem. 6 out of every 10 women diagnosed with PCOD are teenage girls. PCOD affects 5 to 10% of women of reproductive age. Thus, the average age group of women suffering from PCOD varies between 18 to 45 years. It is important for young women to understand this disease at its onset, along with its causes and implications in the future. There are no certain causes of PCOD. However, it is often found associated with low-grade inflammation, excess insulin, production of male hormones in high quantities, and genetics. It is characterized by multiple small cysts in the ovaries. Also, early age of menarche, unhealthy lifestyle, and pollution are some of the contributing factors to this disorder. PCOD often leads to women having irregular periods and difficulty in conceiving. Other complications include increased cholesterol levels, high blood pressure, and sometimes even breast cancer. Lifestyle modification is essential to both prevent as well as treat hormonal disturbances and conditions. The best treatment for PCOD includes timely diagnosis and appropriate steps that can help battle the disorder. PCOD isn't a new condition. Italian physician Antonio Vallisneri first described its symptoms in 1721. Women all over the globe have been dealing with it for a very long time, but awareness about this condition still remains in a dismal state. Richa Sarot Dalal, Democracy News Live, New Delhi.
Good evening, I'm Rohit Gandhi and you're watching Democracy News Live. Welcome to our show, It Matters. Today, we're doing a show around PCOD, polycystic ovarian disorder. It's a very common condition affecting approximately 10% of the women in the age group of 12 to 45. It is a condition in which a woman's hormones are out of balance. In PCOD, there is an imbalance in the sex hormone specifically. Normal development of eggs in the ovaries during each of the menstrual cycle is disrupted. The disorder causes patients to stop ovulating, get pimples, grow extra facial and body hair, and also have problems. It may also lead to a woman facing difficulty in conceiving. It is an issue that women all over the world have been fighting against. But like other issues related to women's reproductive health, talking about it is a big taboo. The lack of awareness about PCOD has led to many doubts and misconceptions. So it is important that we talk about it, and today we chose a panel of a doctor and a patient who are going to discuss this. We have two doctors on the show. First one is Dr. Pallavi Aga. She is a lifestyle consultant as well. Our second guest is Dr. Puja Dewan. She's a gynecologist, IVF specialist, and a laparoscopic surgeon. She'll tell us a bit more about what she does as well in detail. Also joining us is Anmol Mahajan. She's a postgraduate student and is currently pursuing her MA in clinical psychology. She was dealing with PCOD a few years ago, and now she's past that. Let me start this with Anmol. Anmol, could you explain to me, when you first faced the symptoms of PCOD, what was your reaction? Give us a little sense of, how it was to be suffering from PCOD.
All right. So I started experiencing the symptoms when I was in 10th standard, and at the time we kind of ignored it because we were like because I had a very unhealthy lifestyle at that time. I used to eat a lot of unhealthy food, junk food, things like that. So we just attributed it completely to that, and we tried to ignore it. Then after some time, I tried to have a proper healthy meal, started having vegetables and a proper diet, but that didn't actually help much. So when I went to 11th standard, I started the symptoms became worse. So my cycles, they became very irregular. They lasted too long. They did not happen on time. So then we actually went and got a diagnosis from a doctor.
And is it more painful during your cycles? What happens? Give the audience a little bit of a sense so that they can understand this if they're going through it.
So, from what I have asked my friends also, a lot of them experience a lot of pain when they have their cycles. But in my case, I did not experience pain. My problem was that my cycle lasted for too long. Like it lasted for longer than the average duration. So normally cycles last for you bleed for around 7 days in or like at max 14 days, and after that your cycle ends. But in my case, I was bleeding for like 2 months, and then after I would have that cycle, I would not have my cycle for a month, and then I would again have my cycle for like a long period, or
Right.
sometimes I would not have my cycle for months. So that was kind of uncomfortable for me. It was concerning for me because it's not normal.
Sure. Anmol, I'm going to come back to you talking about what happened in the future, but let me bring in Dr. Pallavi here. Dr. Pallavi Aga, you were the one treating Anmol. Explain to us, Dr. Pallavi, how many women go through it? Do you get a lot of cases around it? And what is your guidance to your patients first? What are some of the first things beyond medication?
Thank you so much, first of all, for having me on the show here today and talking about this topic, which I have seen extremely commonly occurring women, especially women, especially teenage girls. It's become like it is a lifestyle disease. I would definitely label it as a lifestyle disease because few years back, maybe because it wasn't diagnosed, or maybe because we did not have such a stressful lifestyle and such an unhealthy lifestyle, PCOD wasn't that very common. What I see in PCOD is, and all the slides which led up to our conversation here has also very succinctly put it, that the underlying cause is usually insulin resistance. And we have to actually the root cause of PCOD. Of course, as Anmol said, she still had a habit of junk food, unhealthy habits, stress eating, so many of such situations, which I give her full marks that she identified all these issues herself and she needed her help to get out of it. And that's where my role came in. But yes, PCOD has become extremely common. So many teenage girls, young women, childbearing age women are suffering from it and getting emotionally distressed over it.
Sure. Great. Let me bring in Dr. Puja Dewan. Dr. Puja Dewan is a gynecologist, and obviously, she's a specialist even further in terms of reproductive health. Uh, Dr. Dewan, explain to me when patients come to you with this disorder, and many of them really young sometimes. Uh, is this like a reversible disorder, or is this for life?
Thank you, Mr. Gandhi, for inviting me on the show, and having heard Anmol and Dr. Agha given their inputs. The question that you have asked me is most pertinent. I would like to share with you that PCOD, as in polycystic ovarian disease, was later renamed as PCOD as polycystic ovarian disorder. Both the terminologies today are of obsolescence and obsolete. The correct terminology as on date is polycystic ovarian syndrome. Now, why did we not call it a disease? Why did we not just call it a disorder? And why did we name it as a syndrome? Here comes the question that it is not a disease of a particular organ like the disease of the ovaries. And it is a syndrome because it affects multitude of organs at the same time. It affects metabolism, it affects hormones, endocrinology, and reproductive dysfunction. And a syndrome is there to last for a lifetime. So, technically speaking, it is not curable. It is with you, you adapt and adjust to it. And something which does not have a cure, how do you manage it? You manage it by addressing the issue which is troubling you at that time. If menses and menstrual irregularities, periods is the issue, you address that, knowing very well that I am trying to challenge it and put it at bay, but it is not curable. if conceiving and becoming a mother is the challenge, then you focus only on that. If facial hair growth, etc., is the challenge, you focus on that. And to just add a few points, as I just heard over from the co-panelists, as Anmol mentioned, that stress plays a lot of role in PCOS. I stand to disagree. In the hypothesis and etiology given for it, stress does not play a role. But yes, because you may have a low self-esteem and you may feel low, sad, depressed. Why is this happening to me? What do people think of me? Why am I not like getting regular periods like other people? You may get stressed out, but that stress is not responsible for having PCOS. And to add some facts and figures and maths to the statistics in the questions that you asked. So 14 to 54 years is the reproductive age group. There are certain criteria based on which the prevalence in the society has been put across. And it can vary from as low as 2% to 26%, but on an average, it's about 9% in the society. And how did we gather that? We gathered that because there was a conference which happened in Rotterdam in 2003, and they said that either there are three criteria. So either the girl is not getting regular periods, or she's getting infrequent periods, or the amount of bleeding is less. This is one criteria. The second criteria is that you do an ultrasound for her, preferably an internal ultrasound if that permits. And that we find that her ovaries are polycystic looking. And when I mean by polycystic ovary means they are slightly larger than normal ovaries and have a particular appearance of number of follicles, which is also larger in number. And the third is the features that we get due to higher hormones, which are the male hormones, that is the androgens. That could be either what we are exhibiting, that is what the doctor is able to see clinically, that there is facial hair, there is hair on your body, chin, nose, here, there, umbilical, around the nipples, breast, or you are doing a blood test and the blood test shows that the male hormones are raised. If out of these three criteria, any two criteria are positive, then only you label the patient to be a polycystic ovarian syndrome.
Sure.
Now, what alarms people is that I'm talking about male hormones in a female. I mean, are we saying that this is a female who is being challenged to turn into a male? No, not at all. Every woman produces both male and female hormones. And the male and female hormones are both produced by the ovary as well. It's just the imbalance that the female hormone is slightly higher normally, otherwise in PCOS the male hormone has become slightly higher. That, however, does not change
which means,
your
Dr.
femininity.
Dewan, which means every male also has female hormones, right?
Yes, you're absolutely right.
Right. And then
So,
I guess
when we are stressed out and when we have the fright and flight stress reaction, and when we produce these adrenalines and the pump hormones, etc., they are actually the precursors to male hormones in a female.
Right.
So we are all blessed to have both male and female hormones. It's just the ratio of the two which has just gone a little topsy-turvy.
Absolutely. No, understood. I'll go back to Anmol here. Anmol, like we heard from both the doctors, explain to me your journey a bit. How old were you when you first recognized it? And then what were the steps it took for you to get out of it? Just so for the audience, who's going through something like this, who wants to understand this. Explain to me, how many years did it take? What is the kind of action it took on your end?
Okay, so the symptoms kind of were there from the time my periods had started. So I would say around they started around when I was 13, 14 years old, and they progressively the symptoms got worse. Then, as I said, in 10th standard, I was having I was bleeding for 2 months at a time, and then I was not having my chums, so that was a matter of concern. But we kind of put it off because nobody wanted to acknowledge that this was the problem. I myself did not want to acknowledge. I was also like, this must be something related to my diet or something like that. Then when I went into my 11th grade, I started doing yoga. I started, as I said, I started taking a proper diet. I started appreciating good food also. So in 11th grade, once my lifestyle was quite good. I was doing all the correct things, waking up at the right time, eating the correct type of food, and all of that, doing exercise. All of that was in line. but my symptoms did not get better. They got a little bit better, but then all of a sudden it just got worse. So then we finally got really concerned, and then we went to the hospital. And as one of the doctors said, they conducted an ultrasound on me, and they also took a blood test, and they diagnosed that I have multiple ovarian cysts and I have some hormonal imbalance. And they did not mention that it was PCOS or PCOD. They just told me that this is what the situation is, and if I take some kind of medication and I make my lifestyle better, then that would help. But I did not take any medication because I was really afraid that I'd be taking the medication for the rest of my life. And I kind of continued over time, the symptoms became less. And then for like during my college years, my symptoms, I kind of got used to them. My cycles also became a bit more regular, but still the irregularities were there. I was overweight, and I did have like excess hair growth and things like that. So then
Did that,
finally, when I
once you were able to kind of resolve some of these issues, did some of these things reverse? Like the excessive hair
the
growth or?
Yeah, the excess hair growth got less, much less, and also I had acne issues. Like in any kind of in winters or summers, I have like outbreaks in my skin, and that also got much better. Yeah, so like
So,
as I resolved a little bit, as I improved on my diet, as I improved on the way my exercise and everything, it did get better. So
we-
those were things, but I never like took any medication specifically for it.
sure,
So
sure.
that changed much later when then when I met Pallavi ma'am, then that's when I started taking some supplements for it, and that also helped
Okay.
a lot.
This brings me to Dr. Pallavi again. Dr. Pallavi, explain to me, how do you, make sure that you can bring the patients back to a normal life where they can lead a normal existence, and then they begin seeing reversal of some of the side effects of having PCOS?
Absolutely. So, of course, most of the underlying cause, the underlying disease, as very correctly pointed out by Dr. Puja, are, when there is a syndrome there, it is set in place. But our objective is to make the life of the patient better. As everybody knows, and all of you are very familiar with it, I am a proponent of the low carb, or what is said in layman's language, the keto diet. And it's except through a lifestyle, through the correct nutrition, taking away the one of the root causes of PCOD, and that's insulin resistance, because most of these patients are insulin resistant, or they are borderline diabetic, and mostly they are overweight, and they need to lose their weight, and then they enter the vicious cycle of exercise more, eat less, which is actually doesn't do them any good, because the moment you tell them to exercise more and eat less, then adds the other vicious cycle of again the stress of the fact that what are going to people going to say, how am I going to go to the gym. And believe me, this exercise more and eat less hypothesis of the calorie in, calorie out concept does not work at all. You cannot ask a person to eat less all their lives, and when we know that it is a syndrome which will be with them all their lives, you have to do something for them which will be a lifestyle change. And that is nothing except for just lowering your carbohydrates. As we It's very clearly known that predominantly nowadays an excessively high carbohydrate diet. Now, when it comes to carbohydrates, what exactly are carbohydrates? They are nothing but complex forms of sugars which are broken down in simple sugars in the body and used for energy. Correct? But these days, none of us are really utilizing this energy, and it's all getting stored as glycogen, as
It's a bit
fatty
of a,
liver, as
ma'am, I'd like to kind
is.
of begin understanding this a bit, a little more deeply. So
Yes,
what you're
yes,
saying is the
absolutely.
carbs that we consume, the carbs that we
Mhm.
consume are white bread, potatoes,
Or any we start with we start in the morning, we wake up, we start with a high carbohydrate breakfast, the so-called healthy breakfast of something like muesli, like granola, like cornflakes, and it's always cornflakes with skimmed milk, it's always
Why
granola with
can't we
milk.
break it down? I want to understand that.
We do break it down, but we that excess sugar, that excess energy is not needed by our body. After eating a breakfast heavy in high in carbohydrates, you can actually go out there and run a marathon,
Right.
but are we really doing that? We are just sitting doing nothing. We are not spending that energy, and that is why there is a boom of obesity, a boom of PCOS, and it's all getting converted. You'll be surprised to see we are having fatty liver in 20-year-olds.
Wow.
Right. So there is not much that we need to think. It's nothing that we are so we have to think about so much. Just do not make the diet hypocaloric. It is not that, it's nothing about eat less. Oh my God, you eat so much. Again, sugars in most of the people are addictive. Carbohydrates are extremely addictive. People can be really carbohydrate addicted. So what happens now, the insulin spikes, the insulin crashes, the sugar dips, and there you immediately start feeling, you have a breakfast at 9, you are hungry at 11, you are again hungry at 1, you are again hungry at 5. So which is happening is the insulin is spiking, it's going down, and all the hormones together with insulin and all of this is going topsy turvy.
Sure.
So why not
Understood.
just remove the carbs?
Understood.
Just remove the
Absolutely.
carbs and
Agreed.
add the
Agreed.
protein,
Let
add the
me.
good quality fats. The
Sure.
protein and the fats is going to give you
Sure.
long-term satiety. And add intermittent fasting, which is nothing but the hunter-gatherer diet of yesteryears, where we were all fasting and eating when the food was given and not munching, snacking, and eating the whole day long. So just intermittent fasting, take away the carbs, add the protein and the fats, and you're good to go.
Let me bring in Dr. Dewan here. Dr. Dewan, now this is the perspective of making sure there is a lifestyle change in how we exercise, how we deal with our diet. On the medical side of things, what are the steps that need to be taken for somebody who is suffering from PCOS? What would be your first advice be? How do they find out? Are there tests for it to find out? And then because it's a large 10% of the population, is a large number of people. Is there enough ability of our system to actually be able to make sure that we can serve the people who are suffering from it?
True. So I'd like to add and just carry forward what Dr. Pallavi has very correctly mentioned. I just want to tell you one thing, that polycystic ovarian syndrome patients, about 60% of them are obese or overweight, but 40% are not. They are actually lean and thin. It's the lean and thin people who are much more severe forms of PCOS than the obese and overweight population. The only lifestyle modification which is in the hands of a polycystic ovarian syndrome patient who is obese is weight control. Now, it is possible in a population that you could be actually having normal weight. You had the genes, you had the conditioning, you had the environment, and now you have eaten a lot and you have put on weight, and now the period irregularity has surfaced. While on the other hand, it is also possible that you could have been plump right from the beginning, and right from the first menses onwards, there was irregularity. So, the diet role truly comes into picture only as a lifestyle modification for the PCOS patients who are overweight or obese. Now in that, what Dr. Pallavi has mentioned very correctly is to have a low glycemic index, in layman words, to have a low carb diet. But you also have to supplement enough proteins, not excess, and you have to put in the correct amount of good fats. Along with that, as Anmol just mentioned, there has
When you
to be
say good
mindful
fats,
eating.
when you say good fats,
Good
what do you
fats.
mean?
What I mean by good fats is there are polysaturated, monounsaturated ones. So the polysaturated ones are the ones which are more difficult to digest, and the monosaturated, like olive oil and all, are lower and easier to digest.
Explain
And when I mention about
which ones are the
poly, would be
poly?
more like Yeah, more like coconut, castor, those ones,
Okay.
which are the higher
Okay.
ones. Yeah,
This
more
Desi
difficult to
Ghee, is
digest.
Desi Ghee the Indian, traditional?
Well, there is a great amount of debate on Desi Ghee because it's enriched with vitamin D, and vitamin D is considered to be a pro-hormone, and deficiency of vitamin D has been found in PCOS patients. So as I said, have a measured amount of good fats, no excess here or there. Because if you need to lose weight, it's not just cutting on the carbs. And keto diet itself, they are also focusing on higher fats so that the carbs come down. And when you asked a question that explain to me why they are not able to digest this glucose or the food intake that they are taking. Simple words. We all have pancreas. Pancreas produces insulin. Insulin helps to digest the glucose that is in the food in the carbohydrate component. Now, in a PCOS patient, they have the same amount of insulin. But that insulin is not recognized by a body, as in it is not recognized that yes, this insulin exists, so there is a insulin resistance. So the insulin is there, but it is incapable of fully converting all the glucose and digesting it. So a vicious cycle develops where the ovaries are also producing some amount of more main hormones, and they further increase the insulin levels. So if you do a blood test on a PCOS patient, you will find they have higher insulin levels both in fasting as well as in post-food phase. Now, because of the higher insulin levels, another vicious cycle of higher androgen male hormone levels comes. Because of higher male hormone levels, you become fatty, and because of higher insulin, you become fatty. Now, because you're not able to digest even some of the fat component, that fat component goes and sticks to your liver and you get a fatty liver. Because the fat level is high, you start getting higher cholesterols and dyslipidemia. Because that is high, you can get blockage in your arteries, in your heart. And because of this whole story, you will become obese. If you become obese, you are likely to get more of hypertension. Now, when insulin is high and the body is not able to digest the glucose, but obvious, you will become a diabetic. Now, whether you are a pre-diabetic, overt diabetic, it is all a matter of detailed diagnosis. So this is what is very relevant to understand. And as Anmol mentioned, there is something known as mindful eating. So what is mindful eating? It is also about your sensing your fullness or hunger sensation, your satiation and your hunger. So accordingly, whether you are going to eat limited or in bits and pieces or going to do intermittent fasting is your methodology. Our medical science from the perspective of a gynecologist does not say that you have to have a keto diet or whatever. It says you have to exercise, you have to have a weight management, you have to limit your carbs. That is the core essence of this. And along with this, as she said, that later on certain supplements were added to her. Now I assume that the supplement can be vitamin D, because vitamin D is considered to be a precursor, and it helps in a lot of PCOS patients, because later studies have been showing that vitamin D is moderately deficient in PCOS patients. And there is another thing. Now, I told you there's lots of insulin and that poor insulin is not able to digest the glucose. So how do you tell that insulin that come, recognize my body's glucose and digest? We give certain things which are inositols, which are also taken as food supplements. So there are a whole lot of things in the picture.
Sure. No, I think a really good discussion today. And I think one of the things that really has come out clearly with all three of you is that this is something that impacts a lot of people, but it's curable. Incurable to the point that, you can actually reverse some of the side effects of it. It may not be the syndrome doesn't go away, but at least you can actually deal with it better. You can understand, you can recognize how to live a more healthier lifestyle, which anyway should be the case. There is no reason to become obese. There is no reason to live a lifestyle which doesn't, work for, leading a good, healthy life. And it impacts not just your PCOS, it impacts everything else in your life as well. Thank you all of you for joining. And this is our shows and these are topics that a lot of people will not discuss. We at Democracy News Live are committed to the idea that we must discuss what needs to be discussed. This is what matters to our population. Thanks for watching. Good night and good luck.